Eating Disorders Unit at Robert Wood Johnson is one of only 2 in the state. We do have specialized care for pediatrics as well as adults.
We do have 24/7 nursing care as well as occupational therapy, which is also unique to our program. Most programs don't actually hire and have an occupational therapist on staff. We have registered dietitians as well as therapists, and the patients get a full complement of patient-centered care from the team. They're given an appointment for a assessment evaluation, a triage appointment. We have an intake room that is private, separate from the unit, right off of our waiting area that the patient is seen in with our doctors, our registered dietitians, sometimes occupational therapy. Nursing will come out and do vital signs. And then at that point, it is discussed with the family, based off of everything that we're seeing, where we think the patient's best suited for with regard to level of care, whether it's inpatient, partial.
Eating disorders are so complex in nature, and it's a great opportunity to be here and get treatment here because we have the ability with a multidisciplinary team, including therapists, dietitians, psychiatrists, and doctors, to treat that complex nature. The advantage of being attached to a hospital system is we have all the resources that we could need on one single campus. As a matter of fact, we're one of only 2 inpatient eating disorder programs in the state.
The Eating Disorder Unit was designed with patient safety and comfort in mind. The environment is really welcoming. It's bright, there's a lot of sunlight. Everything is designed really for comfort and safety. Some of the safety features we have for the unit are beds that are low to the ground. They are safe for behavioral health areas, but they're also designed with the medical component in mind. So they serve for both the psychiatric and medical components of the care that we provide. The chairs are soft, but they're also sturdy, and everything is really there for patient safety and comfort.
So a typical day for all of the patients, adults and children, they wake up early, vital signs are done. Obviously, we do check their weight daily. That is a protected time for the patient, though. So just to reassure, families and patients that it is a blind weight that we track for multitude of reasons. The patients go to breakfast. All meals are supervised by staff. That is a therapeutic time for the patients. That is considered a group. After meals, school begins for the kids. For the adults, we begin group therapies, and group therapies can consist of actual group therapy with a therapist, but we also have creative arts therapists that do art, music. We have yoga specialists who come in and do some movement with the patients when it's deemed that they're able to join. And then after the morning groups, lunch is a therapeutic group that is supervised and served.
Proper nourishment is very powerful. It regulates our hormones, it helps us feel better overall, brings color back to our face, brings our personality back. This is our dining room. This is where our patients have their meals and snacks. I'm standing next to the meal and snack schedule on our whiteboard. The patients have 40 minutes for their meals and 15 minutes for their snacks. Here's where they sit. The staff member in the dining room assigns the seats for the patients. There's always going to be at least one staff member in the room, a mental health associate, a nurse, a dietitian, or a therapist for therapeutic meals. Our staff member maintains appropriate conversations with the patients, make sure they're comfortable during their meals and snacks. Maybe we'll play some appropriate games with them. Our nutrition goals of treatment are to break the eating disorder cycle, establish a structured eating pattern, and reduce eating disorder behavior use.
What's most rewarding about working with the eating disorder population is that we really get to see the change in our patients and just see that brightness come back to them.